we're going to start with a simple physiology and biochemistry background on detoxification, and then we're going to go through a little sharing session. So for detoxification, first thing is to understand that this is from data back in 2020. On average, we consume about 5 grams of microplastic per week. That's 1 credit card per week. So back in 2000 or even 1900s, 1950, 1960, detox is the trend, right? Some people do it because it's cool. But now, today, it's a biological necessity. We get toxins from our life, right? There's endogenous toxin, meaning the toxin is produced within our body, and there's exogenous toxins we get from environment. We get heavy metals in our water, we get air pollutant, we get dyes and paint, not just in our shirt, but in our foods too. Endogenous toxins, we get, when your cells break down, you have cellular debris. When your microbiome metabolize, it produces different harmful chemicals. Even with your hormone, you have metabolites. So all of this create toxin in the body. So even though you say, I have a clean, healthy life and eat organic food, if that patient never done detox before, their body is toxic. So a couple of clinical manifestation of toxin overload, it can cause brain fog, right? Nervous issue, pain, immobility, hormone issues, skin issues, pretty much everything you can think about is associated with inflammation, right? Because when you have toxin in your body, it's not just water soluble. Some toxins are also fat soluble. And when the toxin is fat soluble, it's in your adipose tissue, it's in your organ, it can be in your brain. Right? So every cell is using extra energy to detox, even when you're sleeping. So think about our body has such a great resistance. So many people go through their whole life without detoxing. But that's also why when you detox for the first time, a lot of people say it's a life-changing experience, right? Because you just feel so light. So now we're gonna go through a couple organs that's managing how our body detox. We always think it's just the liver, right? But in reality, it's 5 main organs that are detoxing. Liver, kidney, filter the toxin out so we can pee your toxin out. Your gut, mainly do the elimination. Lungs and your skin through respiration and through sweating to get the toxins out. So it's not just the liver, right? And why is liver the most important? This one we need to go back on anatomy. So we are all familiar with arteries and veins. Artery carries the oxygen and nutrient throughout your body, go through your cell, deliver those nutrients and oxygen, and you circle back to your heart. But portal vein is different. Portal vein connects directly from your large intestine to your liver. It doesn't go back to your heart. It's different from any other vein in your body. So how much toxins are absorbed through your gut? A lot. That's why all the toxin load hit your liver. That's why when we understand the importance of how toxins affect the liver, when your liver is blocked up, you got blocked up and you got a sluggish liver, you can increase all the pressure in your venous system, which can cause edema, varicose vein, because the vein is simply not getting back to the liver. So that's the one thing sometimes we didn't think about. So let's talk about how liver deal with toxins. There are 2 phases, and I think we're all familiar with phase 1 and phase 2 detox. But when we go a little bit into detail, phase 1 is the part where the liver make the toxin more reactive. So you got your fat-soluble, water-soluble toxin, go to this cytochrome P450 enzyme to activate these toxins. The reason they're making it more activate is because they want to get the toxin ready for phase 2. But when they get activated, this intermediate phase is actually more harmful than the unactivated toxins. Now, phase 2 is when the liver starts to conjugate, meaning they start to add some biochemical reaction to make the reactive toxin water-soluble and less toxin. So in this process, we need certain amino acid. We've heard of glutathione, we heard of methylation. All this process are making this toxin easier to get out of the body. So that's the phase 1 and phase 2 detox of what liver is doing. So this is the bottleneck. When some of the detox method, I'm going to use the celery juice cleansing for example. Some people just drink celery juice 20 days ahead without eating anything. Then just push a lot of toxin out of your body. but then the phase 2 is not catching up. There's no vitamin B to help with the methylation. There is no glutathione or antioxidant or phytonutrient to help with this process. There's no amino acid because a lot of people starve themselves. Then the toxin actually get reabsorbed in the body. That's why people feel sick when they do a wrong detox. Some people do a celery juice detox. They have like diarrhea 20 times a day. And they think I'm detoxing, but it's actually because your body is shutting down. You can no longer process anything, so everything needs to get out of your body. So all this nutrient are what make detox smooth, right? It's not just the liver part, it's both part. So when we go into the standard process 21-day purification program, it's different. It's in not because it has more detox agent than other detox product, but because it has the whole food nutrition to fill in the gap. So 4 of the main things that's in the 21-day detox. The first one is the SP cleanse, and that one got the cruciferous vegetables, got clove, got Spanish black radish to help with the phase 1, phase 2 detox. And the second one, the SP complete, provide the amino acid that's necessary for the phase 2 conjugation to happen. And the third one is the gastrofiber. So gastrofiber, we're gonna talk a little bit more about that, but mainly it can help with the elimination process. And the elimination process also are known as the phase 3 detox, because when your toxin get drawn from your body, get processed by the liver, you need to get out of your body. Okay? So the fourth one is the SP green food. So the SP green food is important because it provides all the antioxidant and phytonutrient that's necessary for phase 2 to catch up. And the thing is, all those phytonutrients are not just supporting the liver. It supports all of the detox organ together, the skin, the lung, the gut, the liver, and the kidneys, because it works on supporting the essence of the cell. Right? The ATP process, production process gets smoother, so you have more energy to detox. A little bit more about the gastrofiber, because fiber is not usually a thing that's included in the detox, because people think it's simple. If I can poop, I don't need fiber. But fiber in here has a very specific purpose, is that our body cannot digest fiber, right? Fiber are mainly the food for beneficial gut microbiomes. So when you feed those beneficial gut microbiomes, it produces short-chain fatty acid. So essentially we can understand it as the good bacteria produce short-chain fatty acid, but the bad bacteria produce something called lipopolysaccharide. And that thing is going to make your gut lining looser. So if someone have H. pylori infection, if someone got yeast infection, those waste of the negative bacteria can cause leaky gut to happen more often. So in a way, if you feed those beneficial bacteria the right nutrient, the fiber, those short-chain fatty acids are going to help with making the intestinal barrier tighter. Why is that important? Because we just talk about the portal vein. If your gut lining is loose, your liver is pushing out all the toxin to your large intestine, it's going to get all reabsorbed, right? So a lot of people get more reaction from detoxing. So if you can close up those gaps and make sure the toxin get minimally reabsorbed, that's an ideal situation, right? So here are the two things. Normally with other detox product, a lot of only focus on liver, heavy on liver. Standard process support cell in general, phytonutrient and antioxidant. Phase 2 support, essential amino acid is needed, but a lot of detox, they just don't eat anything to thought you can get more benefit from losing weight, right? Which is not true. Microbiome balance, we talk about the fiber feeding the beneficial bacteria, making a gut junction tighter. Free radical neutralization, again, when we go to that phase 1 detox, all the toxins are becoming more reactive. You need the phytonutrient to support that phase 2 conjugation part of the detox to balance out that equation. So that's later we're going to have a sharing session to see if we try the detox product from other brand, and we can just kind of share what's different. Okay. So this is a list of some certain ingredient in the 21-day detox. The Spanish black radish, very great for phase 1 and phase 2 detox. And it has an important role because it has the high sulfur content. And sulfication, just like methylation, is also a part that helps liver to conjugate toxins. Alfalfa juice, high chlorophyll content, phytonutrient, and also provide a high antioxidant activity. Beetroot, we all know how beetroot affect liver and gallbladder detox, sluggish gallbladder, sluggish liver. We want to make sure the pipe is clean. Buckwheat, in here, it has a very good vascular regeneration ability. And we talk about when you have artery and vein, those are the pipe that deliver the toxins. So the buckwheat also adds another layer of detox in the 21-day. Lastly is the fiber, which we talk about, help with the phase 3 elimination and feed the beneficial probiotics. Okay? So this is the main message. When the toxins are being removed, the body is simultaneously built. So when people go through detox with the standard process 21-day purification program, you get the first week when you're on SP cleanse, you get a little headache, a little low, a little tired. But then when you introduce the SP green, what you usually see, what people usually report is they feel very energetic. Energy start to come up, they start to feel more awakened compared to the traditional detox. You just kind of feel sick throughout the whole way, right? How do we assess toxin in our body? Can we order a blood test? There are organic acid tests. There are different microbiome tests we can do. But we talk about if it's a fat-soluble toxin, it can be stored in your organs. It can be stored in your nervous system. It can be stored in your brain. So you can't really have a very efficient way to test for toxin in the body. So what we see is we usually do this toxin questionnaire and just to assess where they are. So in our clinic, we do pre and post testing for all the clients that go through detox. And usually we see a direct association when the overall toxic questionnaire point is lower, symptomatically they feel better. So it's one of the ways we're using mainly in the clinic. We also do comprehensive blood panel, and we also see a lot of people, their inflammation factor goes lower, and the cholesterol drop. But we think there's a lot of different reason why cholesterol can be high. So we still think the toxic questionnaire is the best one. A little clinical gem we share is we found that the biggest obstacle to finish a detox is not knowledge. All the clients who want to do detox, they're already in. They know they need a detox, they want to do it, but usually what makes them to drop out of the program is it's the symptoms they're experiencing. If the headache is just getting too much, they're getting too tired, or their GI system is too uncomfortable, it's too reactive. What we found is if we add another 2 months to support the patient's neurology, so their sympathetic and parasympathetic nervous system are more balanced, then their digestive tract is more balanced due to the parasympathetic activity. And then we support the upper and lower digestive system. Only then when we do the detox. So instead of having patients just start the detox right away, we prep their body up. And what we find is the compliance rate increase up to 90%. People usually feel a little low, a little tired the first 3 to 5 days, but then it's a smooth ride after. And when any of your patients can go through a full detox journey, they usually love it, right? A lot of people ask, can I do it again in 3 months? No, we say, yeah, usually do it again every year. Don't do it too often. But when it's a good experience and they feel like they're getting lighter, their weights are dropping and their blood tests are improving, then they understand the effect of detox, right? So this is kind of experience we encourage every single one of the patients to go through when they start on this journey of holistic or optimal health. And that will be all.